Hi friends, welcome to the channel The Nurse. Here we are discussing about medical and surgical nursing questions and answers with the rationals. After a short gap, we are starting again. So we will move to the topic medical and surgical questions. Before that, if you are not subscribed to our channel, please subscribe. So MSN MCQs with rationals. First question. A male infant weighing 3 kg is born via spontaneous vaginal delivery at 37 weeks gestation. His Apgar score is 6 by 9 at 1 and 5th minutes. The patient is no apparent distress. Physical examination reveals no anus. What is the most appropriate initial step in this patient's management? Colostomy, continued observation for 24 hours, intubation and mechanical ventilation, magnetic resonance imaging of the abdomen and pelvis. So correct answer here. The baby should be continue the observation for 24 hours. If there is no anus also, we need to wait for 24 hours. Continued observation for 24 hours. The patient should be observed for delayed passage of meconium, as this can be normal up to 48 hours of life. So delayed passage of meconium can be happen. So we need to wait for 48 hours. If delayed beyond these 48 hours, meconium ileus, there are some possible reasons for that. The first one is meconium ileus, then meconium plug may be there, then imperforate anus or Hirschsprung disease. These are the reasons for delayed passage of meconium more than 48 hours. Evaluation of imperforate anus should be include inspection for drainage of meconium through a fistula to the perineum or the urinary tract, because this significantly alters treatment. Specifically, fistulae occur with low termination of the colon or rectum, which can be managed definitively with anorectoplasty. If fistula is there, repair can be done, anorectoplasty repair can be done. If there is no fistula, then treatment will be different. Absence of a fistula significantly increases the likelihood of high defect, that is imperforate anus, which can be managed with colostomy and subsequent contrast imaging of the distal column or rectum, followed by a definitive repair at a few months of age. Initially, imperforate anus managed with colostomy, then later of baby's life period, a definitive repair of the imperforate anus can be done. Some surgeons obtain a cross-table lateral abdominal radiograph, that is X-ray, to determine where the terminal colon or rectum lies in relation to perineum. But this approach is unnecessary and is not widely practiced, because the repair is doing in later part of the life of the baby. So there is usually not recommended the X-ray also at the initial at the time of birth. Ultrasonography and radiography are required to rule out vectoral association, but there is no need for MRI. Intubation and mechanical ventilation are not indicated in the case. What is vectoral association? Vectoral association is a disorder that affects many body systems. Vectoral stands for there are group of defects. First V stands for vertebral defects. A stands for anal atresia, then cardiac defects, trachea, esophageal fistula, renal anomalies and limb anomalies. These are the group of disorder comes under vectoral association. So there is a imperforate anus, there is a chance of other system involvement of other systems. That is why we need to screen the vectoral association. Second question, which of the following conditions is characterized by inflammation of the inner lining of the heart chambers and heart valves? Myocardial infarction, endocarditis, pericarditis, aortic stenosis. Easy question. Correct answer is endocarditis. Endocardium is the inner lining of the heart. Endocarditis is an infection of the endocardium, that is inner lining of the heart chambers and walls. It can be caused by bacteria, fungi or other pathogens. Common risk factors include intravenous drug use, prosthetic heart valves and congenital heart disease. Congenital heart disease. Third question. Which organ is most commonly injured in blunt abdominal trauma? Liver, spleen, kidney, pancreas. Usually after road traffic accident, which abdominal organ is commonly injured? So correct answer is spleen. The spleen is the most commonly injured organ in blunt abdominal trauma. It is highly vascular and located in the left upper quadrant. So usually the spleen injury leads to hemoperitoneum. Rupture of the spleen can lead to significant bleeding and hypovolemic shock. Then fourth question. A patient involved in a car crash complains of sharp chest pain worsened by breathing. On examination, you note decreased breath sound on the left side. What is the likely diagnosis? Pneumothorax, cor pulmonale, rib fracture, pulmonary condition. Correct answer is pneumothorax. The symptoms described, that is sharp chest pain worsened by breathing and decreased breath sounds, are consistent with a pneumothorax. In a pneumothorax, air accumulates in the pleural space, that is in between the pleura, causing lung collapse and decreased breath sounds. So pneumothorax may be due to fractured lips or any sharp injury. According to the START means Simple Triagender Rapid Treatment System, which color tag indicates a patient with minor injuries. So START triaging is used to treat mass casualty. So in that minor injuries colored under which minor injuries colored with which color? Red, yellow, green, black. Correct answer is green color. So what is indicated by red color or yellow or black? You can comment your answer below. The green tag in the START triage system indicates minor injuries. Patients with green tags have non-life-threatening conditions and can wait for medical attention, while more critical patients are prioritized. So more critical patients are categorized under which color? That is what you need to comment below. So START system or Simple Triage and Rapid Treatment System is a triage method used by first responders to quickly classify victims during a mass casualty incident based on the severity of their injury. Sixth question. Which genetic disorder is caused by mutations in CFTR gene leading to thick and sticky mucus production? Cystic fibrosis, hemophilia, phenylketonuria, Tay-Sachs disease. Correct answer is cystic fibrosis. The cystic fibrosis transmembrane conductance regulator, that is what CFTR gene, is responsible for producing a protein that helps regulate the movement of chloride ions in and out of the cells. So mutations will lead to the production of CFTR gene that will lead to cystic fibrosis. It primarily affects the respiratory and digestive system, leading to lung infections, pancreatic insufficiency and poor growth. Seventh question. A patient with a head injury presents with unequal pupils. What condition should you suspect? Concussion, abrasion, subdural hematoma, skull fracture. So here we can suspect brain damage. So that may be due to subdural hematoma. So subdural hematoma will increase the ICP, that will compress the brain tissue. Unequal pupils, it is also known as anisocoria. Unequal pupils, also called as anisocoria. This is another MCQs. Can be indicative of expanding intracranial hematoma such as subdural or epidural hematoma. These conditions require urgent intervention to prevent further neurological deterioration. So unequal pupil, one of the indication for indication of the brain damage. If it is untreated, it will lead to permanent brain damage. Which of the following condition is characterized by chest pain or discomfort due to reduced blood flow to the heart muscle? Atrial fibrillation, angina pectoris, ventricular tachycardia, cardiac tamponade. It is also an easy question. Correct answer is angina pectoris. Angina is caused by temporary ischemia, that is lack of blood flow to the heart muscles. It typically represents as chest pain or discomfort and is often triggered by physical exertion or emotional stress. Which chromosomal disorder results from an extra X chromosome in males? X chromosome, that means sex chromosome. Options are Down syndrome, Klinefelter syndrome, Turner syndrome, Creutzfeldt syndrome. Correct answer, Klinefelter syndrome. Extra X chromosome, that will lead to Klinefelter syndrome. Klinefelter syndrome occurs when a male has an extra X chromosome. So that is represented by extra X, XY. Usually XY will be there. In this case, male person have extra X chromosomes. It leads to hypogonadism, tall stature, and learning difficulties. Klinefelter syndrome symptoms are includes hypogonadism, tall stature, and learning difficulties. 10th question. Which genetic disorder is associated with repetitive expansion of CGG trinucleotide repeats on the X chromosome? Huntington disease, Duchenne muscular dystrophy, Fragile X syndrome, Marfan syndrome. So it is a little difficult question. Correct answer is Fragile X syndrome. Fragile X syndrome is the most common inherited cause of intellectual disability and is characterized by cognitive impairment, social anxiety, and hyperactivity. These are the symptoms of Fragile X syndrome. 11th question. In a road traffic accident, what is the first priority in managing a patient with the suspected spinal cord injury? Administer pain medication, immobilize the spine, assess airway and breathing, check for external bleeding. So in the case of suspected spinal cord injury, we need to immobilize the spine first. So that is the first priority, immobilize the spine. Immobilizing the spine is the first priority in suspected spinal cord injury. It prevents further damage to the spinal cord and minimizes the risk of paralysis. Airway and breathing assessment follow once the spine is stabilized. So immediately after spine is stabilized, we can go for airway and breathing assessment. 12th question. Which of the congenital heart defects results in a blue baby due to inadequate oxygenation of the blood? Tautology of Fallot's, patent ductus arteriosus, atrial septal defects, coarctation of aorta. So correct answer is tetralogy of Fallot leads to blue baby syndrome. Tetralogy of Fallot is a combination of 4 heart defects including pulmonary stenosis, right ventricular hypertrophy, ventricular septal defect, and overriding of aorta. It leads to decreased oxygen levels in the blood, causing cyanosis, that is bluish discoloration. Next, 13th question. Which genetic disorder is characterized by the absence of an X chromosome in females? In Klinefelter's extra X chromosomes in males. In this question, absence of X chromosomes in females. Females means X will be there usually. So in this condition, there will be one X chromosome is missing. Options: Down syndrome, Turner syndrome, Klinefelter syndrome, Fragile X syndrome. So correct answer here, Turner syndrome. Turner syndrome results from the complete or partial loss of one X chromosomes in females. Common features include short statures, webbed neck, and ovarian dysfunctions. So these are the symptoms of Turner syndrome, that is due to lack of X chromosomes in females. 14th questions. A patient presents with sudden onset of confusion, disorientation, and visual hallucinations. Which organic disorder should be considered? So here the important word is organic disorder. It is given in question itself. So options are schizophrenia, bipolar disorder, delirium, obsessive compulsive disorders. So if you understand the meaning of organic disorder and psychiatric disorder, you can easily answer here. Correct answer is delirium. Delirium is one of the organic disorder, or all other three options are examples of psychiatric or mental health disorders. Delirium is characterized by acute confusion, altered consciousness, and perceptual disturbances, that is, hallucinations. It often results from medical conditions, that is, example, infections, metabolic imbalance, or drug toxicity. That is why it is known as organic. Some infections related to brain or metabolic imbalance or drug toxicity, these are leads to organic disorders. Schizophrenia and bipolar disorders are not typically associated with sudden onset confusion. The correct answer is C, delirium. Then today's last question here. Which of the following is a key feature of psychosis? Rational thought process, emotional stability, impaired perception of reality, adaptive coping strategies. Correct answer is impaired perception of reality. All other options are characteristics of normal persons. So only impaired perception of reality, that is one of the key feature of psychosis. The person is away from the reality. Psychosis is characterized by impaired perception of reality. Individuals experiencing psychosis may have delusions, that is false fixed beliefs, and hallucinations, that is false sensory perceptions. Rational thought process and emotional stability are compromised during psychotic episodes. So usually it will be seen in normal persons. So in psychotic episodes, these symptoms, these characters are compromised. Rational thought process and emotional stability, etc., are compromised in psychotic conditions. So that is about today's video. Thank you for watching this video. So please like and share with your friends, and also don't forget to subscribe our channel, The Nurse. So if you have any doubt, you can ask in comment sections. So please stay tuned. We will come with another video. So thank you.